washing my hands, putting gloves on. Hey Sarah, my name's Corey. I'm going to be your nurse today.
Oh, nice to
Can
meet you.
I check your wristband?
Yeah.
Will you tell me your name and your date of birth?
Yeah, my name is Sarah Smith and my date of birth is 11/13/2001.
Alright, perfect. And can you tell me where you are right now?
I'm in the hospital.
And why are you here?
I was thinking I have a UTI or something.
Okay. And do you know who the president is?
Yes, Biden.
And what year is it?
2022.
Okay. Patient is awake alert oriented ×4. Now we look straight ahead at me. Pupils are equal, round, and reactive to light. And will you open your mouth for me? Okay. And mouth is pink, moist, not missing any teeth. And Sarah, do you wear any glasses or contacts to help you see?
No.
And do you have any hearing aids? Alright. And I'm going to get started getting your vitals. Okay, blood pressure is 110/72. I am going to get your temperature. Okay, temp is 37 degrees Celsius. I'm going to go ahead and listen to your heart. S1 and S2 were heard, normal rate and rhythm, no abnormal heart sounds. So now I'm going to get started listening to your lungs. Okay, and will you sit up for me so I can listen to your back? Alright, sit back for me. All lung sounds are clear. No adventitious lung sounds heard. Chest is rising and falling symmetrically. No accessory muscle use. And will you put your arms out like this? Alright, just gonna feel your pulses. Upper extremity pulses, both +2 bilaterally strong. Respiration rate is 20, heart rate is 88. Alrighty, and will you squeeze both my fingers, please? Alrighty, perfect. Upper extremity strength is a 5, completely normal. And your skin, warm to touch, appropriate color for race. And now I'm going to take a minute and check your stomach out. Okay. Upon inspection, no obvious distension, appears flat. I'm going to listen to your stomach. Bowel sounds are normal active in all 4 quadrants. Are you having any abdominal pain anywhere?
Actually, yes, I'm having a little bit in my lower stomach.
Lower stomach. Alright, so I'm going to start with the upper and just tell me if this hurts at all. Is that okay? Okay.
Yeah, a little bit.
Down here hurts?
Yeah.
Okay, what would you rate your pain?
I'd rate it about a 5.
Okay. And when was your last bowel movement?
Yesterday.
And are you having any issues urinating?
Yes, I've been feeling a lot of urgency and been going a lot more than usual. And then when I urinate, it's kind of a strong smell and it's a bit cloudy.
Okay, what about, is it yellow or clear?
Yellow.
You were going to the restroom, is it burning at all?
Yeah, a little bit.
Okay. And are you experiencing any nausea or vomiting?
No.
And what about diarrhea?
No.
When you get up and use the restroom or walk around, are you using any assistive devices like a walker or anything?
No.
Alrighty, I'm gonna come down here. Feel pedal pulses. Lower extremity pulses are equal bilaterally +2. And then will you pull back on the toes or on push down? Alrighty. Patient does not have an IV, no obvious drains. Do you have any wounds that we should be aware of? No wounds, skin is intact. This patient's name is Sarah Smith. She's a 20-year-old female who came into the ED with signs and symptoms of a UTI and reported that she felt ill. She brought herself in from home and claims the symptoms started 2 days ago, and she also has no known allergies. She claims she is sexually active and not on any form of birth control. She has no history of previous UTIs and denies lower back pain or seeing any blood in her urine. Upon the assessment today, her BP was 110/72, her heart rate was 88, respirations 20 with her O2 stat at 100% on room air, and her temp was 37 degrees Celsius. She did complain of lower abdominal pain that she rated as a 5 on a scale of 1 to 10, urinary frequency and urgency, and burning with urination. We did obtain a urine sample and the urine was yellow, cloudy, and strong smelling. However, all other body systems were completely normal and she had no other complaints. The doctor did prescribe her Bactrim to take for her UTI, so I think she should receive some education and teaching before she leaves on her new medication and about UTI prevention. As she was diagnosed with risk for ineffective therapeutic regimen management, her priorities of care is that she understands how often to take her medication, the possible signs and symptoms of the medication, what steps to take in the future to prevent any more UTIs from occurring, and the possible complications that can arise from a UTI and when to come back into the ED. Sounds good.